Hello, this is Armando again for the video for lower extremity. Now we're in the second part of the video, mobilization for the knee of the case, and I'll be focusing on increasing the knee flexion and medial glide of the patella, incorporated in weight-bearing activities. So this is the initial position of the patient in standing, and I hope you can appreciate that this leg is weight-bearing and foot is on a stool like this. And the reason why we want those mobilization to be incorporated in this position is we need to improve the ambulation of the patient and weight-bearing activities. So the tibial part of the leg is articulating on the femur, and the one moving in this area in open kinematic chain will be the concave side. So in order to increase the flexion, what we need to do is posterior glide, going that way. So this is the position of the patient. Hand placement of the therapist will be this way. So but we want to move the leg going, we want to mobilize it going backwards. So what we're gonna do is move the tibia on a planted foot going this way. So in applying grade 1 to 4, it will be grade 1 will be oscillation, barely moving the articulation or the proximal side of the tibia. Grade 2 will be more range. Grade 3 will be to the limit. And you have to make sure that the patient is not rocking forward and back. You have to tell the patient to stand still and put more weight on the leg, and you do your mobilization from there. So grade 2 will be resistance free. And then grade 3 will be to the limit. And I think the patient is still moving. So I'll probably have to ask her not to move. Okay, just keep your foot planted on the stool, and then don't rock yourself. So it means that you are not supposed to rock forward and back on the other leg. So keep your feet on the stool. So let's do it again. So grade 1 will be barely moving it. Grade 2 will be resistance free. Large amplitude. And then grade 3 will be to the limit. Large amplitude. Grade 4 will be to the limit but short return. So that will give you a small amplitude of oscillation at the limit or at the end range of the accessory joint motion. So since the patient has no problem with her knees, it's really hard to do the mobilization. But I bet in the clinics, when patients are having trouble, doing the knee flexion, it will be better appreciated. So the other mobilization will be focused on patellofemoral joint. So I picked this mobilization since in walking, it's not just the tibiofemoral is the only one moving or doing the job. Patella serves as the a bone that could give better leverage to the the thigh muscle or the quads. So here it is. We could start from full extension, and in this position we could really move the patella, because this is the loose back position of the patella. So for our patient right now, I have no problem moving it. So if you wanna start from this position, you can have your left hand behind the knee, and then the heel of your right hand will be starting, or will be rested from the lateral side, anterior and lateral side of the patella, and you're gonna move it medially, since that's what lacking in our patient in the case. So motion will be going that way, going to the medial side of the knee. And as the patient feels more comfortable, and as you feel the increase in range and ease of motion in the patellofemoral joint, you might want to ask the patient to bend a little bit, and then you can move the patella again, going medially. And as you progress, you can move it to a greater range of motion as to flexion, or you can even incorporate sustain glide going medially when the patient is bending the knee. So can you bend your knee? So what I'm doing here is I'm gliding the patella going medially, and then ask the patient to move back from original position. So I just saw the patient now wince or complain of pain. So I think in doing this mobilization in real setting, we should be more careful, since most of our clients are geriatric, and it will be we should expect some arthritis going on, and it will be more painful for them to squeeze and compress the patella. So again, if I want to show you the grade 1 to 4 for this mobilization, from this position, grade 1 will be, barely moving the patella. I hope you can see that small amplitude of oscillation. And grade 2 will be larger, but still resistance free. Grade 3 will be to the limit. Can you see? I hope you saw that. I moved the patella to the limit. And then large amplitude of motion. The return will be larger, going to original position. And then grade 4 will be to the limit, end range, and then small amplitude of mobilization. So as for progression, you can have the patient bend her knee a little bit, and then you do grade 1 to 4 again. So grade 1, grade 2, resistance free, large amplitude. Grade 3 will be end range, large amplitude. Grade 4 will be to the limit, and then small amplitude. Or you can have you can help the patella to go medially while the patient bend her knees. So bend the knee, then move it, then back, move it again. So there you go. Those two were antero-posterior glide to increase knee flexion, and medial glide over the patellofemoral joint, in which we incorporated weight bearing for the lower extremity. So last will be ankle, and I'll stop this video for the meantime, and I'll be back.